Well, welcome to this talk and welcome back to Professor David Nutt. Professor, thank you for coming back.
Absolute pleasure, John. Looking forward to it.
Now, you more than me, but when I was 18, I started seeing the destructive effects of alcohol. I saw people die when I was 18 from alcohol-related illness as a first-year student psychiatric nurse. And a few years after that, I was foolish enough to start drinking myself. I've now stopped. But alcohol is like a huge global issue, really, I think. And you are a psychiatrist, you're an addiction specialist. And I know you have a particular interest, it could be said disdain perhaps, for alcohol. Tell us how you got interested, basically.
Well, my story is rather similar to yours. Before I went to university, what I wanted to do was to drink, but the pubs were quite good at excluding under 18-year-olds. And then my very first day at university, there were 9 students in my college, at Downing College, Cambridge, doing medicine, and we do what groups of students do when they went out on their first night. We went to the local pub, and we had a few pints. After 3 pints, I was a pretty... I thought that's enough, because I hadn't really drunk before. But then we went back to college, and because we had to be in by 10:30 because they closed the gates, and you needed special written permission to stay out after 10:30. We went back inside. Someone got out a couple of bottles of wine. People started drinking. I didn't. I sat around chatting. And then a couple of hours later, one of the students started crying and wailing and saying, he wanted to die. He was so miserable and so unhappy. And I thought, wow, he's going to commit suicide. And I said, should we call an ambulance? And one of the other guys who knew him from their school, he said, no, he's always like this when he's drunk. And that shook me up in 2 ways. Firstly, because, really he shouldn't have been drinking at all. He just made it old enough to. And secondly, wow, the power of alcohol to turn someone from actually what turned out to be quite a successful career as a doctor, blighted, I have to say, in his case, by alcohol. But he still made it, and turning from an A-grade student to someone who was actually wanting to die. I thought, wow, this is fascinating. Alcohol changes the brain very powerfully, and of course, then when I became qualified a few years later as a doctor, every day you would see someone who was damaged from alcohol. Half the orthopedic wards are occupied by people who've had accidents under alcohol.
On our nurses' station, where the doctors aren't allowed on A&E, where we make up the drugs, there's normally a few bottles of confiscated alcohol, bottles of vodka and things. I mean, alcohol is just like everywhere. It's ubiquitous.
Yes.
One of the regrets in my life is making light of it, joking about it, as people do. Just this following on with my cultural norms rather than thinking about it objectively. It really is a powerful drug, and we talked about that tragic case there, but what you might call ordinary people can also be dramatically affected by alcohol. It's a powerful drug, and what I'd like to know is, how is alcohol actually working in the brain?
Well, before I just tell you that, which I obviously want to do, I'll just tell you a statistic which I think a lot of people don't really understand. Alcohol globally kills over 3 million people a year. That is more than the total of all, apart from tobacco, all other drugs put together.
Yeah.
And so, yes.
All of the drugs that people take for the buzz, for the fun.
Yes, whether you use opiates, cocaine, amphetamines, whatever.
Cannabis,
I mean, overall, alcohol is at least 3 times more than all other drugs put together. So, that just tells you it's a massive problem. Yeah. But it also, of course, it tells you that people like to drink, because no one's forced to drink. So people choose to do it without probably understanding the harms. And the reasons for that, or we can talk about in a minute. But to answer your specific question, what happens when you drink? Well, it depends a lot on whether you're a seasoned drinker or a naive drinker. If you do an experiment on a baby or a child, and you just dip your your finger, say, into a whiskey or a vodka and put it on their tongue, it's very aversive. No, in fact, people say, I like alcohol. I say, you don't. You've probably never ever drunk neat alcohol. All the alcohol we drink is flavoured to take away those those bitter, sour, toxic effects on the tongue. But over time, of course, people who become experienced drinkers get to know that the taste is associated in a few minutes with the pleasure. So eventually, people who, as a child, would spit out a 50-pound bottle of, a mouthful of a 50-pound bottle of claret, when they get to our age, they savour it because they've become so sophisticated and acquired, the relationship between the taste and the effect that they now revere it rather than find it aversive. So for people who drink regularly, the smell and the flavour are immediately begin to recreate in the brain the desired experience, and then as it flows down your gullet. And of course, actually with spirits, that's even more of an interesting aspect, because for people who drink relatively neat scotch, there's that burning sensation in the back of the throat, which actually is, for many people, a good sign. They like that. That makes them feel warm and flushed. And the alcohol then trickles down into the stomach, gets absorbed into the bloodstream, goes through the portal vein into the liver, and it gets broken down. Part of it gets broken down to acetaldehyde, but some of it doesn't. And what doesn't gets back into the systemic circulation, gets into the brain. So within about 5 to 10 minutes, alcohol has gone from your mouth to your brain. And there it begins to do what most people drink for, which is relax you and calm you down and take away, particularly social anxiety, the anxiety that we all have in social situations, which, of course, is where most people drink. Most people drink in social groups to avoid their anxiety.
Well, many don't. I've certainly, I don't know how cathartic people want this session to be, but I've drank on my own purely for the effect on the brain, purely for the.
Yes, and that's, I have to say, that's thanks for mentioning it, but one of the points I make in my book is that solitary drinking misses most of the value of alcohol. Yes, you drink by yourself to get basically numbed, or to relax, but then get numbed. But it's a dangerous thing to do, and you probably realise that yourself in time and have stopped.
Yeah, I've realised that. And mention your book there, David. Drink. Now,
question mark. Drink question mark.
Drink. Yeah. It's. I mean, your many years of experience comes through in this book, but it's eminently readable. I think it was only about £7, £8 from Amazon or something. So
yeah,
I think this book's for two types of people. To be quite honest, I think it's for people that drink, so they can understand more about what alcohol is doing. And I also think, probably even more importantly, the other group that this book is useful for is those that don't drink. Read this before you start, because in medicine we have a special word for that. It's called informed consent.
Yes.
Special 2 words.
Yes.
So read this and then decide if you want to start drinking or not. My advice would unequivocally be, if you haven't started drinking, whatever you do, do not start if you haven't started already. But if you do, that adds a lot of layman's context.
Thank you. Can I just say the book is designed there's thousands of books on the wonders of alcohol, and there's hundreds of books on the dangers of alcohol and the value of sobriety. And I just try to tell the truth.
Yeah.
For some people, alcohol is very dangerous. 15-20% of drinkers will end up becoming dependent.
Yeah.
We can predict some of them. I mean, pointers, if your father was an alcoholic, you're more vulnerable. Or your brothers and sisters, as it runs in the family. So it's clearly a genetic aspect. So if you're vulnerable, if the only time you can relax and socialise is when you're drinking, then you're at high risk of becoming dependent, because socialisation is something you do all the time. So be aware. Try to work out while you drink. And one of my key tips is only ever drink a drink that you can reflect back gave you some benefit, because if it's not giving you benefits, it's harming you.
Mm-hmm. I think there's a lot of psychology here as well. I mean, the whole psychology of addiction, but the stimulus response whole thing. You mean, you go into a bar, you maybe order a pint of real ale or whatever your tipple is, and you sort of sit there and you look at it. And, the effect's almost starting before you've taken the first sip, isn't it?
Oh, definitely. I mean, when you see when you see adverts for booze, that's why I wish we would ban adverts for booze.
Yeah.
I start, on a warm day, you see a beer with a, bit of condensation. I'm salivating before. Yeah, absolutely.
Yeah.
You become really very strongly conditioned to alcohol. Absolutely.
Yeah. And then there's always an excuse. Oh, it's a hot summer's day. I need a drink to cool me down. Oh, it's a cold winter's night. I can't go out. I might as well have a drink by the fire.
Warm me up.
It's.
Yes.
I'm reminded you and me will remember this, but a great film called Ice Cold in Alex.
Oh boy, yes,
indeed. Where John Mills he hacks through the desert for days on end with a what's that called anyway? I remember I fancied her for years. The nurse in that video, in that film, Gene Sims. Yeah, and they hack through they hack through the desert. They fight off the germs. Then he pours the lager, and he runs his finger up the side of the glass, and he looks at the lager, and but I can relate to that.
I can now. I'm already. I can taste it.
Worth waiting for.
Yeah.
I can remember the film. I can taste that.
Yeah. Actually, it's just an interesting aside. That was about the 8th take on that film, on that fact. So when that take was actually taken, he was already pretty far gone. Apparently, yeah, it was the 8th take. Nice work if you can get it. More of a real ale man myself, but
Same here.
Yeah.
But they didn't carry very well. It was difficult to get real ale into Egypt.
It was probably quite tricky, yeah. But what about the harms that alcohol? Now, before we do that, just give us a bit of the geeky stuff, the neurotransmitters, the GABA, the dopamine, the glutamate, the endorphins, as to name a few random transmitters in no particular order.
Well, I think you've summed them up rather well. You obviously read them.
I've read the book.
Alcohol has a stepwise interaction with the brain, and the first effect is to enhance the activity of this neurotransmitter called GABA. Now, GABA is not a transmitter that many people have heard about.
So it's GABA first.
Gamma aminobutyric acid, yes, but it's a hugely important because it's the brain. It's the off switch of the brain. It's the calming neurotransmitter. It dampens down brain function.
Is that where the benzodiazepines work? The Valium, Librium type drugs?
Yes, they work on the GABA receptor. They work on subtypes of the GABA receptor. I won't go into the complexity of the system because it is very complex, but the reality is that things that calm you down tend to enhance GABA, right. and that's most people drink because. Certainly in social situations, we're a bit socially anxious. I mean, humans, I like to say this, humans are actually a really social species. I mean, we love to go to parties, but we're not very good at being social because we're always anxious when we go. Strange.
Isn't it?
And even when we meet members of our family that we haven't seen for a while, there was that tension. And I think that's evolutionarily helpful. I mean, being slightly cautious of strangers. Probably is protective, but it doesn't help you get to know them. And alcohol, that first drink or so, enhances GABA, relaxes you, particularly in those parts of the brain which you need to relax in order to socialize. And that's great. And if we just stopped at that, then we'd be happy. But for many people, we can't stop. And when you start to increase the dose, you begin to engage other transmitters. You begin to release dopamine.
Right.
And that's where people start to get activated. They get louder. They may get a bit competitive. They may get a bit aggressive. And the thing about dopamine is it's a moreish transmitter. You release dopamine, you like it. It's cocaine, amphetamine do that. But then as the levels fall, you want more. So dopamine is one of the transmitters which gets you addicted to alcohol.
Yeah. And for me, it's the trigger dose as well. The amount of times I've said, I'll have a pint. And of course, you end up having more than a pint.
Yes. And that is partly dopamine. But also there's an interaction, interestingly, between dopamine and endorphins.
Okay.
And they work together to basically encourage your brain to say, I need some more, I want some more, to chip away at the resistance.
Oh, yeah.
And we know that for instance, if you block the endorphin system, there was a medicine out there called narmorphine, you block the endorphin system, it reduces to some extent people's going from a couple of drinks to a binge, because that seems to have an endorphin drive.
I mean, I tend to associate endorphins with morphine, opiates. Is that?
Well, it's exactly the problem.
Same transmitter.
Yes. So what morphine does, morphine mimics and exaggerates the effect of endorphins. Whereas alcohol releases endorphins, but they both, in the end, there's still this propensity. Endorphins are painkillers in the brain, but they also have motivational role, and they also have some role in addictive behaviors, and addiction to alcohol is one of their roles. So
this is a real biochemical, neurobiological drug that alcohol is having. It's taken systemically. Yes. It goes through this blood-brain barrier and gets deep into your brain. What causes the? A lot of people ask me this: does alcohol increase sexual appetite, or does it just inhibit?
Oh, Shakespeare put it brilliantly.
Inhibitions.
It just inhibits you. He said.
Yeah, you're disinhibited.
It works to the effect that alcohol increases the desire, but messes with the function.
yeah. Although I wouldn't count on that. Especially for young people watching.
No, well, unfortunately, yeah. I mean, it's actually alcoholism is a very common cause of basically impotence.
Yeah. Eventually, yeah. So, what harmful effect does alcohol have on the body? I mean, I once met a man, and he said, "John, I like to drink. Tell me how I can drink as much as possible without harming myself." Interesting the way sometimes this mentality works, but what are the main harms that alcohol has on the body? Probably thinking more. I mean, obviously you can get drunk and fall down the stairs. I mean, there's a common diagnosis in A&E. I'm sure you have it in psychiatry. It's called PFO.
Remind me.
PFO. It's a family show, so let's say Pede fell over.
Quite.
Is he a PFO? Go and see to the PFO in cubicle 3. It's appalling when you think about it.
It is, but it's hugely important.
Yeah.
Because alcohol is probably the only drug that we can image the brains of people who drink and show they're damaged by alcohol. Even drugs like cocaine don't produce objective changes in brain function that alcohol does. Alcohol shrinks the brain, but it also damages the brain. But part of the damage, particularly in men, is due to that kind of violence, accidents, fights, traffic crashes, etc. Brain injury occasioned by being drunk. So that's the first thing, I suppose, to say. If you want to avoid harming your brain when you're drinking, don't stand up, because falling over is a problem.
Well, yeah.
But on a more serious note, alcohol, there's almost no organ system in the body that alcohol doesn't harm. Yeah. And you kind of know that. I mean, everyone knows, when you have a cut, you put an alcohol spray, to kill the bugs. Well, if it's killing bugs, And bugs have pretty tough capsules. It's going to kill neurons, and it's going to kill other cells in your body. And that's what it does. Alcohol and the metabolite acetaldehyde, they're both relatively toxic. So wherever the alcohol gets, it starts to irritate. It irritates the mouth, and it's associated with increased levels of mouth cancer, particularly in smokers, because the two, alcohol and tobacco, have an aggregative effect. It's associated with esophageal cancer because it burns as it goes down. It's associated with stomach cancer and stomach ulcers. It's strongly associated, obviously, with liver cirrhosis. People often don't realise, though, more people die of alcohol-related hypertension and stroke than die of cirrhosis. It's one of the few preventable causes of hypertension. In heavy drinkers, it causes cardiomyopathy. The heart just swells and becomes not very functional. And then, of course, it damages the brain, and it shrinks the brain and kills neurons. And it's a major it's again one of the few preventable causes of dementia.
Yeah, and the peripheral nerves can be damaged as well, can't they?
Very much so. But yes, of course, that when people become alcohol dependent, they often become vitamin deficient. They lose sensation in their toes and their ankles, and they get tingling. They get peripheral neuropathy, which then aggravate. They trip over as well and cut themselves and that.
So a question I get asked really quite often is it true alcohol kills brain cells? So
Yes.
So alcohol is killing brain cells directly?
Yes, it is. It's killing brain cells by turning off another neurotransmitter we didn't get to, which is called glutamate.
Oh, right, yeah.
And here's the paradox. So when you start to forget, when you start to get alcoholic-related amnesia, that's because alcohol blocks the glutamate receptor in the brain. Now, the glutamate receptor is the receptor in the brain that keeps you awake and alert. And that's why, in the old days, people used to use alcohol as an anesthetic, because it dampens down the on switch of the brain, the glutamate switch. So it impairs your memory. So even if you could feel the pain, you didn't remember it. Now, the problem is glutamate is essential to your brain function. Your brain knows when it's being impaired, when the glutamate's being blocked. So it compensates. And it compensates by making more glutamate receptors to try to offset the effect of alcohol. And the brain's good at doing that. Turns on more receptors. And that's one of the reasons why people can drink a hell of an amount over a night and not be anaesthetized or falling over, because the brain is compensating. But when they stop drinking, the alcohol levels in the brain fall faster than the brain can readjust its glutamate receptors. And that's why you get a hangover. And there's also this recently named but long known phenomenon called hangxiety. People are very anxious when they're coming out of an alcohol binge.
Yeah.
And that's because there's too much glutamate in the brain. And we know that glutamate kills neurons. Too much glutamate kills neurons. And that's why you have GABA in your brain, to make sure the glutamate isn't overactive and killing neurons. But there are situations where you have too much glutamate, like in epilepsy, where we know neurons die. And the same is true for alcohol withdrawal. It's the withdrawal of alcohol that is really toxic to neurons.
So alcohol is going to suppress glutamate. The brain makes more glutamate to compensate.
Correct.
The alcohol goes away from the brain because the liver metabolizes it. But the brain is still overcompensating and producing more glutamate, which makes you feel basically terrified.
Correct. Anxious, fits. People have fits in their alcohol withdrawal. Also, it turns on the sympathetic nervous system, so you get his heart pounding and your blood pressure surging. Yes.
Glutamate stimulates the sympathetic nervous system, the fight or flight.
It does. It drives the sympathetic nervous system in the brain, and that then goes into periphery and makes the heart beat and the blood pressure go up, etc.
Yeah, and that's what some people get even abnormal rhythms of the heart after drinking. Is that a glutamate effect?
That's a great question. Now, I suspect it is. You're probably aware there's been a lot of interest in the last few years in in cardiac and particularly atrial arrhythmias, atrial fibrillation. There's a lot of talk about it. A lot of people are on anticoagulant medication for the fibrillation. A lot of that is due to too much drinking. I think, my recommendation is that anyone who's fibrillating, cut your drinking down.
And that's not well known. Most people don't know that.
No. Yes, absolutely. And same with hypertension. If your blood pressure's up, before you go on meds, cut your blood pressure, cut your alcohol down. And, there's quite good data that giving up drinking will dramatically reduce your blood pressure by maybe 10 to 15 millimeters systolic.
That's a lot. And as well as that, of course, there's the calorific component, because
absolutely.
Weight is blood pressure and weight are quite tightly bound
together.
It's
been estimated. We used to think it was old men that were drinking and putting on weight through alcohol, but in fact we now know it's actually young women. A lot of them are getting half their calories through alcohol, and often they're compensating by eating even less, so then which aggravates their problems. And alcohol is not a good food source.
Why do people eat kebabs on the way home from the pub? Because normally you wouldn't consider eating a kebab, it's unconscionable. But after a few pints it seems like quite a good idea.
Yes, it's a really interesting question, that. I've reflected a great deal on that in my life. As you say, you find yourself eating things you wouldn't want to eat.
Yeah.
I think I don't know the answer to that. It's partly disinhibition, taking away your restraint. One of the tips that I think a very powerful tip in relation to weight loss is that people on diet shouldn't drink, because alcohol definitely dissolves the resolve not to eat. It's very
you've got the calories from the alcohol, and then the calories from then they think, I don't see any reason not to. Rice pudding or whatever it is.
No, alcohol dissolves self-control.
Yeah,
I think we can all say that, and whether that self-control is directed at what you say to people or what you eat. So if you're on a diet, don't drink till you've got to the weight you want to get to. So that's partly. So it's partly a brain effect. Alcohol taking away the will to restrain, but it probably affects appetite as well. I mean, we know that the alcohol changes the metabolism of glycogen in the liver, and it puts you into a slightly hypoglycemic state, which also then triggers the desire to eat. So it's a sort of vicious circle, really.
I've looked after a lot of people with quite severe mental health disorders, not as many as you, and a lot of them drink, and there was always the debate: is this someone with schizophrenia who drinks, or is it someone who drinks? Which is cause and effect. It's a ludicrous question, but in mental health, let's put it this way: do people who have mental health disorders drink by self-medicating?
Yeah, that is actually the much more common route.
Right.
Strange. It's just very strange, but more people become alcoholic because in the late 20s, early 30s, 40s, drinking to deal with stress, than are alcoholic from the ones who are in the teens who are drinking because for the hell of it.
Yeah.
Self-medication is a primary driver, and that's so important, because if you can work out why they're drinking and then use processes to deal with the anxiety or the depression or the trauma, you can really cut down on the drinking.
I've certainly drank for both reasons. I've drank for positive reasons because it's fun, especially with your mates, and but I've also drank for negative reasons.
Yeah.
When you've been in a job for 20, 25 years and it's not going very well, you've got a lot of stake on the table there. Really, it's
quite.
Or a marriage, a relationship situation. It's very, very understandable. But I think the thing is, the reason we have people like you is to avoid people like me self-medicating. You're able to prescribe much more appropriate treatments than alcohol.
That is true. I think, but alcohol is a very cunning drug. Because it does work when when life is tough. Alcohol can dampen down the stress. It can numb you. It can take away a lot of even quite severe trauma. We know military veterans can numb the memories that they can't cope with alcohol. But the problem is, because of this daily cycle where the alcohol numbs and the brain overcompensates and makes it worse, it's like a ratchet effect. Every time you are suppressing things, they're coming back worse. They're getting energy from the brain adaptations. So in the end, you end up having the problem that your problems got worse and you're also alcohol dependent, which in itself is a major trauma. I mean, people, once you're dependent on alcohol, you make a lot of bad decisions in life, and that then aggravates your stress levels.
Yeah, but the temptation's always there, because, you take that drink and you know that within 5 or 10 minutes, the world's a better place. That instant gratification.
It is.
If you prescribe antidepressants, I'm going to be hanging around for a month waiting to feel better.
That is true.
Not talking about psychedelics, but
that is also true.
But with alcohol, just bang. Actually, it's not so bad after all. But of course, the next day, the way I think about this is with alcohol, you're borrowing happiness from the next day.
That's a very interesting analogy. I like that. Yeah.
And you pay it back with interest.
You do, absolutely, especially that next morning. Can I just make another point here?
Please.
Since we're trying to educate people, if you are suffering a lot of anxiety in the morning after drinking the night before, and you're shaky and anxious and worried about going to work, do not ever drink to cope with that. Yeah. We call that relief drinking. And it is the slippery slope. Once you start drinking so that you can function after a night of drinking, you're an alcoholic.
Yeah, and again, we've seen this really quite commonly. Certainly, I've seen a lot of colleagues drinking at lunchtime. So that's...
Yes.
So this anxious feeling you get after the reason I had to, I'm not saying I completely stopped drinking, but more or less stopped. Maybe have a blip every few months now. But was as I've got older, the drinking a relatively small amount will actually give me quite a bad hangover, and this hangxiety. Is it old age metabolism? Is it have I just become more sensible, or is there a biochemical change that means I can't metabolize it properly anymore?
No, you've become more it's interesting. You've become more sensible, and that's what you've observed is really something that I've observed too. As you drink less, you become more vulnerable to what you drink, and of course, and again, this is the paradox of alcohol. Well, I know if I just have a large glass of wine at night, it will affect my sleep. I absolutely can tell you. A glass of wine and I will wake up half an hour earlier. 2 glasses of wine, I'll wake up. It's absolutely predictable.
I wake up at 3 o'clock in the morning being anxious.
There you go. Exactly.
Yeah.
Well, before, you were sort of the system was desensitized. Now your system is back to normal, and they're slightly more reactive, so that you experience so you don't need so much to get you drunk, by the way. But on the other hand, the less, even though you drink less, you still have the more adaptation in the brain, because your brain is not completely tolerant.
So if someone's been drinking heavily for a period of time, they'll get a physical withdrawal or abstinence syndrome. The shakes, the DTs, the delirium tremens. Is that a separate phenomena from a hangover, or is there an overlap between the two?
Yeah, again, really interesting question. So there's definitely an overlap in the sense that hangovers precede delirium. But delirium is a state where your brain becomes so overactive that, it starts to make things up, basically. It's a state of hyperglutamate activity, too little GABA activity, strangely too much dopamine activity. And that's probably because the glutamate system is pushing the dopamine system, because dopamine is also a stress response system as well as a pleasure system. And then when you get pumping out too much dopamine, you begin to get paranoid. And delirium that's what it is. Delirium is a state where your consciousness is impaired and you become very, very suspicious. You see things, you hear things that aren't there. You see classical hallucinations like spiders and elephants and that, and
Snakes,
and actually snakes, yeah. And delirium tremens is a medical emergency. People have seizures and they die in delirium tremens. You've got to treat it really very actively. If people with severe, people who are very alcohol dependent, they should go through what we would, a medically controlled withdrawal, where they're given drugs like benzodiazepines to dampen down the excitability, so they don't go through a worsening, which then leads to, once they start having seizures or delirium, it's very hard to reverse.
Yeah, we normally give, in A&E, we give patients Librium, the chlordiazepam oxide, and it does seem to work remarkably well.
Oh, it's been a revolution, actually. Because you can get, basically it's very safe. You give people, especially people who are tolerant to alcohol, they're tolerant to benzo, so you can give them, usually a big dose, 60, 100 milligrams of chlordiazepam oxide, and then that sits around in their body for a few days, so it sort of covers them through that period of alcohol withdrawal. I mean, sometimes they need a top up, but usually it's one big dose and then littler descending top ups.
If you were on a remote island in the Outer Hebrides and your alcoholic friend was going into withdrawal and you couldn't get to a doctor for the next few days, would it be safer to actually give them a drink so that they could detoxify under medical supervision?
Yeah, it probably would. I mean, but it would have to be that you gave them the drink rather than that they took it themselves. Yeah. We used to, John, you might remember, I don't know, you're a bit younger than me, but when I first started in medicine, we would occasionally give people intravenous alcohol to help them deal with things like withdrawal. It was available as a medicine.
I never gave that. I seem to remember it as an antidote for drinking antifreeze.
Oh, right. Okay. I'd forgotten about that.
Yeah. What we used to do was, when I was a psychiatrist nurse, we gave heminevrin. And
yes.
Of course, it was a drink. You poured it out.
Yeah, absolutely.
And the alcoholics used to really savour it, and then they'd nick a bottle, go out and drink heminevrin and alcohol together and get totally plastered.
That was, I mean, there was hope that heminevrin would be essentially the methadone for alcohol.
Yeah, but it didn't really work.
It didn't know, because it didn't have the right kind. Methadone has one great advantage: you just need to take it once a day.
Yeah.
If you had a once a day heminevrin that people would just take and it would last that long, then in a way, chlordiazepam oxide, Librium is like that.
Yeah. Yeah.
I mean, and just occasionally we would use it on a regular daily basis to help people stop drinking, but the problem is that they can always drink on top.
Got so much reminiscing from the old psychiatric days. But I remember we changed it from the drink into we called it the duck eggs, the yellow capsules. So you didn't have the
that's right.
The charge nurse to say, "I'll give him his duck eggs." That was the heminevrin. Really serious question. Periconceptually, pregnancy. If we do men first of all, if men smoke before they facilitate a conception, that can damage the chromosomes in the sperm and lead to deleterious effects in the child that's subsequently born, even cancers. I mean, is that the same with alcohol, or can men just carry on merrily drinking while trying to conceive?
I'm not sure it affects the genome, but it certainly affects the sperm production, I think. And
does it?
So I think it impedes fertility in men to some extent. Yeah.
And what about women drinking round about conception and in pregnancy?
It's not ideal, but I want to qualify this, and this is important. Yes, a lot of women become very, very anxious because they discovered they got pregnant because they were, and they were drunk when they got pregnant.
Yeah.
And then there are people who would say, well, you've damaged your baby, and the answer is, I think if you don't carry on drinking when you're pregnant, you probably haven't damaged your baby.
Yeah.
But there are a small proportion of women who drink who cannot stop or don't care, and they can drink. And then that first trimester, heavy drinking the first trimester, has a really deleterious effect on the fetus.
Yeah.
So ideally, as soon as you know you're pregnant, you stop drinking. And ideally, when you're intending to get pregnant, you don't drink heavily. You maybe just a glass of wine a day or no more, because we don't know exactly what the threshold is, and it's probable that there's some effect at low levels, but it's the very high levels that are the real problem. And people don't realise that fetal alcohol syndrome causes more developmental problems than Down syndrome and Fragile X put together. So it is the most common cause of developmental problems, learning disabilities in kids, and many of the kids end up being in homes all their lives because their behaviour is so disrupted by the alcohol brain damage.
So part of the fetal alcohol syndrome is that the physical architecture of the child's brain is distorted.
It is, and it's in the same way as their face looks different and their hearts may be different, but their brain, it works in a very different, and it's almost like they're in overdrive. Many of them have really severe hyperactivity. They're sort of relentlessly active. They can't sit still. It's like extreme ADHD, and it's probably got something to do with, well, the brains are smaller, and I think just so we're now understanding that one of the brain is obviously a really complicated organ, but one of the sort of key principles is that the frontal cortex controls the rest of the brain generally.
Yeah.
And if your frontal cortex is damaged, like from a road traffic accident or too much drinking, it's harder to control your behaviour. And these kids are born with less ability to regulate their behaviours, their activities, and they sometimes just can never learn to sit in class, to read a book. They're just they're brain damaged essentially.
That's my simplistic way to think about it, that the frontal cortex, the frontal lobes of the brain, are sort of controlling the lower, if you like, animal parts of the brain. It's the Phineas Gage story, isn't it? The guy who...
oh, yes. Well, tell people... Yeah, tell your audience about that, because that is a remarkable story.
Oh, Phineas Gage, at the time, it was actually quite early. I think he was about 1830s, was he? And he was...
in the 1800s, yeah, in America.
Yeah, and he was packing. He had a bar. And he was packing in the dynamite.
Yep.
And the bar blew out, and it went in there and out there, and everyone assumed he would die, but he didn't. He got better. Yep. But he changed to, I think he was a lay preacher, like Clark Kent, the mild-mannered reporter, and he became a bit of a lad round town by all accounts, and. Drinking, womanizing, and because the control part of his brain had been damaged.
Exactly. And that's very similar to what we see with people who have frontal injury, motorbike cyclists coming off, smashing their front of the head, horse riders.
Yeah,
and these kids, and of course we also see it in dementia, frontal dementia, that often is associated
FTD,
behavioural disturbance, much more than memory disturbance.
Yeah. In the old days, those old psychiatric boys called that Pick's disease. It's now called frontotemporal dementia. Yeah, I can see I'm tweaking some of your distant memory circuits here, David.
I do remember. I remember learning about Pick's.
Yeah. Horrible disease, though. My brother got frontotemporal dementia. It's in a sense, it's a bit funny because the disinhibition is like, so ludicrous, but sadly it develops.
So it's like the lack of insight. Yes, the sort of it is like putting going back to being really a baby, isn't it?
It really is.
Impulsive. You see something, you want it, you take it. Someone else is like, "What's mine? Why shouldn't I have it?"
Yeah. Now, I started drinking when I was about 19 or 20. About 19. So. Yeah, 19 to 20 I started drinking, really. Would I have done myself more harm if I'd started drinking 5 years earlier?
Almost
early
certainly.
Teenage.
One of the strange kind of laws of drinking which applies across the Western world anyway, is that people start drinking on average about 5 years before they're allowed to buy, and they become alcoholic. They become dependent on average 2 to 3 years before they're allowed to buy. So the median age for becoming alcohol dependent in Britain is about 15. Kids start drinking from about 12, and we know that half of 15-year-olds, both men and women, girls and boys, are drunk at least once a month.
Half of 15-year-olds are drunk once a month, at least.
And that's been the same for the last 35, 40 years. And so the answer is, for some of them, quite a lot of harm has already been done by the time they get to drinking age, because dependence is dependence on alcohol is a massive problem, because it's there everywhere. It's easy to get. You've got advertisements all the time encourage you to drink. So it's a really difficult dependence to escape from, because there is no escape. There's nowhere you can go where alcohol isn't present.
It's just everywhere. Absolutely, it's ubiquitous. Now, I know you've got another meeting shortly, David. So, is there any?
No problem.
Are you okay? Right, yeah.
Yeah, no, I can go up to near an hour. Yeah.
Yeah. Quality of life is so much worse when you drink, isn't it? Sleep, nutrition, work, creativity. I mean,
yeah.
What would you say about alcohol's effect on the quality of life?
Well, I would say if you drink within the current recommended guidelines, so less than 14 units a week, and you don't take all those units in one go, you're probably all right. But once you beyond those limits, you are likely to discover that you're impairing your life, your quality of life in some way. And the thing is, you won't know until you cut down. And that's why it's worth doing the experiment, to find out whether you actually really need the alcohol, whether it is improving your life, or whether you're just drinking because that's out of bad habit. Let me give you an amazing statistic out of the... Nick Sherwin was professor of hepatology at Southampton University, and he's a sort of Britain's expert on alcohol and the liver, and he would monitor people coming in with alcoholic liver disease into his clinic. And a third of them didn't meet any criteria of being alcoholic. And they said, well, they weren't classic alcoholics. They weren't getting drunk. They weren't having fights. They weren't having severe withdrawal. They were just drinking a bottle of wine a night with their partners. They're middle-class people just drinking. We just drink like the French do, but we're pickling our livers over 10, 20 years. The French get cirrhosis, so do we.
Yeah, no, I've seen cirrhosis in people that wouldn't consider. I mean, there's other factors, but alcohol's a big one, and people that just consider themselves social drinkers.
Yeah, that's right. Yes, you.
So a third of cirrhosis occurring in basically non-alcoholics.
Yeah, people who don't. Yeah, that's right.
You see,
would never be diagnosed. A GP would never pick it up. Unless you say, how much do you actually drink? And they would probably just say half a bottle.
So I mean,
then if you double it, as you should.
Yeah, I mean, I'm not an alcoholic. Alcoholics are people that live in the streets, and they drink bottles of cider out of brown paper packets on the park bench, and they're sick and they haven't got any teeth, and they go to hospital all the time. We have this amazing ability to rationalise.
And that is, of course, the message.
Some people are down there that they're the alcoholics, whereas we're
perpetuate. It doesn't. Nice, comfortable middle class people like us. Doesn't matter how much we drink, we'll never suffer. But of course, that's not true.
No, can't possibly be a problem.
There's this wonderful study. It's called the Westminster study. The study of looking at civil servants, showing there's a very clear relationship between how much you drink and how small your brain is. The people that drink more have smaller brains. Over the course of 20, 30 years. The Whitehall study, it's called, and double your drinking, doubles the shrinkage of your brain. It's pretty clear.
I always taught my students to work out units. So a unit of alcohol being 10 mils
Yeah, yeah.
and how many units are in various drinks, and working it out as a percentage and things, and the amount of intelligent young people that were genuinely, I'd say probably about maybe 10, 15, 20% of the class were genuinely shocked by how much they drank in the past few weeks. They actually didn't realise.
No, and that's a huge. I mean, I'm glad you do that, because most people don't want to know the truth about their drinking. We're one of the strengths of humans is we minimise things, but in the end, that's to our detriment. And one of the tips I give to people is that there are 5 variables that you really should know for yourself. You should know your weight, and you probably know your waist circumference, your blood pressure, your cholesterol, and your drinking. And with all those, you should almost certainly be trying to reduce them all.
That sounds like pretty good advice. If you drink, you excrete more vitamin B and vitamin C. So if someone's drinking regularly, should they take vitamin supplements, or is that just a...
No, you should, absolutely.
You should.
I mean, you absolutely, yes. And particularly, we know that heavy drinkers, when you're getting to the point where alcohol is the dominant energy source, you're going to be seriously B1 deficient and probably B12 deficient, and that can lead people into a terrible situation, a severe neurological illness called Wernicke's encephalopathy, where your brain is actually, parts of your brain, particularly the memory circuit, is dying because it doesn't have enough vitamin B1. So it's a medical emergency, and we should actually why don't we put B1 into drinks? Because the drinks industry won't let us. Because they think it might change the taste. I'm not sure it would, but they don't even want to admit that drinking is the main cause of Wernicke's. So this is a historic problem. We've known this for, I think Wernicke was about 1890, so it's not, but we've consistently refused to bite the bullet and help people not get Wernicke's by adding vitamin B1s to drinks or to foodstuffs even.
Yeah, so when you drink, basically you're weeing out your your water soluble vitamins. That's the problem.
Yeah, and you're also the inflammation in the gut that alcohol causes reduces the ability for you to absorb them, even if you take them. So you've got to give people, best of all, give them injections once they're in that state.
And of course, we do this very, very regularly in the healthcare situation. I think now it's called Pabrinex. In the old days, it was called Parentrovite.
Right, Parentrovite, yes.
But now we put it in a 100ml bag and drip it in, and it's a nice yellow colour. And it's really important, but it's not always done. It's not always done. Yeah, it certainly should be. Now, what is it about human beings that like to leave reality for a short period of time, from time to time? Is this some intrinsic defect that we have? Because people have been abusing various psychotropic compounds. Well, Noah planted a vineyard as soon as he came out the ark. It seemed to be one of his priorities, and I'm sure people were having the odd tipple well before that as well.
Yes.
What is it that we seem to need something?
Yeah, it's. I think there are two aspects to it. The first is that because we've got such big brains, and we've got this huge expansion of our frontal cortex. The frontal cortex is where we think about the future.
Yeah.
And for most of us, thinking about the future is stressful. and so, you do, and if you're doing that day in, day out, you'll get tense, and alcohol is a phenomenal relaxant.
It's just like I used to think of it sometimes as a safety raft. You could just go on and float on for it, have a few hours off.
It is, and I think I want to, alcohol. My book is not about alcohol being good or bad. It's about it's both. It's both.
There is no moralising in this at all.
Thank you.
It's scientific.
And yes, but the other aspect of alcohol, which we've briefly touched on also, is that it is a pro-social drug. It is the most social of all drugs. Most of us have met partners through social lubrication with alcohol, and that's a good thing, because if we didn't, then we wouldn't probably be in relationships. So it is definitely a social drug, and there are anthropologists and paleontologists who think things like Stonehenge were built to bring people together. There were places where there were great celebrations particularly of beer drinking, in order for tribes to make peace, but also to make new mates, to sort of spread the gene pool. So alcohol has a very special place in human society in terms of facilitating social interaction.
It's absolutely true.
So it's good as well as bad.
Right, last question I'm going to ask you. Is alcoholism a disease?
Well, alcohol dependence for some people is, once you're dependent, your brain has changed, and therefore it's a disease in the same way as alcohol cirrhosis is a disease. Your body has changed as a result of your drinking. The propensity to becoming dependent is also, in a way, it's a sort of prodrome of a disease, but is obviously, it's not inevitable. And there are people who have got high risks of becoming alcoholic. Now, boys whose dads are alcoholic, if they don't drink at all, then they won't become alcoholic. So it's not inevitable, but once you start, for some people, it's easier the slope is steeper for some people than others.
The reason I asked that, I was disappointed. But when I retired from academia, I did some clinical work again, and amongst doctors and nurses, I did find a lot of judgmentalism about alcoholism. To me, it is a disease problem, and I have empathy with the alcoholic the same as I do with an appendicitis. It's
absolutely, yeah. A society that not only allows advertising but also makes a lot of money from the tax on alcohol,
and then surprise, 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 some people use the drug. It's
double standards.
Yeah. Now let's get on to your new invention. If only there was an alternative to alcohol.
Have you got one, John?
Oh, I've got several. Yeah. So you kindly sent me some. Now I have no commercial interest in this at all. The reason I'm doing this, David, is I consider the Bacchus to be quite a wild, raving animal that goes around tearing people apart. Alcohol is a real problem, and that's what I want to. That's why I'm highlighting this. But you've invented this stuff. So there's the red for relaxation, and this smells like nothing I've ever smelled before. And I had that one with a ginger beer, I think. Then there's the yellow, which
the gold we call it, John. The gold. Yes, of course. Yeah. It's our Prosecco equivalent. It's the summer citrusy drink.
Yeah. I'm not so sure about the black. I've only tried that once, but my son and my wife both really like them. So on a small sample size. So what the heck is this stuff, David?
Well, the drinks you're talking about are called SENTIA. They're SENTIA red, black and gold. They're 3 different flavours, but also have slightly different ingredients. But the core of them all are herbs that enhance the effects of GABA in the brain. So SENTIA is designed to mimic a drink of alcohol.
And I must say, I was amazed. I drank this, and I felt like I'd had a double gin, but there's no alcohol at all in it.
0 alcohol, absolutely. It's just herbs, which we've known historically from Chinese medicine, Ayurvedic medicine, and also, interestingly, historic British herbal drinks, which have been designed and used for centuries to relax people. And that's what we want to achieve. We want to give people a drink which can relax them, like alcohol relaxes them, but without turning on the dopamine, the endorphins, without blocking the glutamate. So this is a drink which targets just GABA.
Now, if these drinks artificially stimulate GABA, surely that's going to reduce the amount of GABA that my body produces, like a benzodiazepine, or am I wrong about that?
No, it's a really important question. And it's one that's, we get asked a lot, and we've obviously thought a huge amount about it. And the way we minimize that is this. We minimise it, firstly, by the herbs in Sentia you cannot get drunk on. Even if we recommend 25 ml units, we recommend no more than 100 mils a day, because that fits within the recommended daily allowance for the herbs. But even if you were to drink a whole bottle, you wouldn't get drunk. So the compensation in your brain wouldn't really kick in, because you're not messing with your brain that much. And the other way we mitigate sort of development of tolerance is because it doesn't hang around as long as alcohol. And so there's less time for the brain. There's less need for the brain to adapt, and there's less time for the brain to adapt. So we're generally not... we haven't had anyone report to us that they, for instance, get disrupted sleep in the mornings like you would if you were getting tolerance to alcohol.
But, if you take... I mean, I'm not saying it's the same as benzodiazepines, but if you take benzodiazepines regularly, then you stop. Your anxiety will be worse than it was to begin with, because you're altering the GABA. I mean...
Yeah.
Is that... Are you fairly happy that that's not a risk here?
Well, firstly, it doesn't work on the same site as the benzos. That's the first thing. And the second is that we do know there are benzos which are only used in anaesthesia. Well, you don't get tolerance, because if you just knock someone out for 10, 15 minutes, the brain doesn't adapt. The ones that, if you're taking something like diazepam or chlorodiazepoxide for 5-6 years, your brain will adapt. The long half-life ones cause more adaptation, because the brain they're always sitting on the receptors. But we're deliberately we're minimizing the time that we're changing the GABA system. And as I say, Sentia doesn't work through those mechanisms anyway.
I mean, if I took this, and first of all, you get some effect virtually straight away, I must say. It's a very similar to alcohol effect, pleasant. So it presumably must be going through the mouth somehow, because within seconds I could feel some sort of...
yeah, that's right. I mean, it's quite a lot of herbs in there. I mean, some people think they love the taste, some people are not so sure, but it definitely stimulates both your sense of smell and your sense of taste, and those nerves feed straight in to your brain centers where you gauge liking and appetite. So so you're beginning. It's like turning on it's the same circuit as you turn on if you were sipping your first sip of your favorite ale.
But you could still drive home.
Well, we say if you're feeling changed, you could be quite relaxed on Sentia, then you shouldn't drive. If your mental state is not as acute as it should be for driving, you shouldn't. But we're pretty confident the effect will wear off a lot faster than if you got to the same level of relaxation with alcohol. Yeah,
I mean, I must say I found the taste extraordinarily. It's unlike anything I've tasted before, but in a very positive way. My wife absolutely loves. Which one does she like? She likes the red one. Yeah, my son quite likes. Yeah, my son quite liked the yellow one, the gold one. Sorry. Yeah.
Old one, so it's interesting. People vary, and that's one of the reasons we've got these very different drinks. Because some people say, I hate the black, and others say, I love the black, and it depends on whether you like spicy things, you want to be, you want to, or whether you like relaxing things. So the red's for relaxation, sitting down with your wife over a meal, or and then the gold's for when your son and all his friends come around for a afternoon party. Yeah. And the black, the black you can use, the black goes very well with things like Coke or ginger ale. It's a spicy, activating drink. Yeah. But they all relax you. I mean,
they do. It's quite extraordinary.
But it took a long time to get there, John. It's about 6 years of research.
Were you and your wife in the kitchen jiggling around with different herbal preparations?
No, I was doing it with some sciencey friends who work with us.
No, it really is. Personally, I think the taste is fantastic. I mean, I'm sniffing this. It smells like walking into a... So sometimes in Asia, you get like shops where they sell herbs and spices and all sorts of stuff.
Exactly.
That's what it smells like.
We've had Indians say, "Wow, this is great. I remember drinking this when this is what my granny used to give me this when I was a kid. It's almost medicinal." And so it uses, and of course, it uses herbs which have positive effects, and people remember positive effects.
Is it potentially addictive?
I don't think so. I mean, I'll say that for two reasons, John. I'll say that for two. The first is, I don't think you can get intoxicated enough. And the second is, and perhaps this is a more important thing, many people have said to us, well, I'm an ex-alcoholic, should I drink it? And we say, well, we certainly couldn't recommend it, but, if you do choose, let us know. And many of them have said, I chose, I did, and actually I enjoyed it, but it didn't bring back any alcohol craving, because it's not like alcohol. Alcohol craving is through something more deeper than GABA. It's through glutamate or dopamine or endorphin.
So this is GABA, it's not endorphins, it's not dopamine, it's not glutamate.
Correct.
Yeah, because I must say, if I drink a double gin, which I don't really do anymore, but if I did, I think, I'll just have another.
Yes. But
with this, I didn't.
Exactly.
I didn't. I thought, that's quite nice, and then it wore off after about. I think I must say this black one. This seems to work slowly, but I could feel this for about 3 hours, maybe 3.5 hours. This one, the gold, seemed to work really quickly, but not last as long. I mean, it's probably just me, but.
Well, it probably is just you, but it's partly the aromas too, and the taste. And black is a spicier taste, and I think for some people, that isn't what they're used to getting in a drink.
But the idea that you could go out on a social occasion and have this as an alternative to alcohol I think it's a really good idea. Over time, with mass production, it's relatively expensive at the moment. Now, you only need 25 mils at a time, so it lasts for a while. Yeah. Do you think with mass production it will get? Because there's no doubt in my mind this is going to catch on.
Well, I hope so. The way forward is
will it get cheaper?
Well, it'll get different, Sean. And it'll get different in two interesting ways. So if you're interested, at the end of this month, we will have available a beer and a stout. Alcohol-free beer, alcohol-free stout, that has in it the ingredients that give you the effect. We're calling it GABA. And if you'd like, I'll send you.
Please do. Yeah, please do.
So that'll be a lot cheaper. And then the next way, the other approach we're working on is to make it in a can, so people can have a pre-made can. You would have maybe the red and tonic, and that'll bring the price down, so people won't have to have a bottle sitting there. They can just buy a can. Such
a good. I mean, with not drinking, I'll maybe go out for a meal or go to Witherspoons or something. And you can have some juice and a tonic and some water, but it's not quite the same as a drink. Whereas this is much more like a drink.
Well, it is a drink, and we call it. I mean, much as I don't want to be remembering what Tony Blair said, but it is the third way. You can see on the bottle they've got 3 dots, so it's not alcohol and it's not non-alcoholic. It's functional. Yeah. It's a functional, alcohol-free, functional drink, and we think people should. Well, we know people want it. Yep. We think people should be allowed to get it, and we personally we're thinking of starting a kind of campaign to. It would be nice if any social events which are put on by government funded, local authority funded councils and that, any taxpayer funding, we think it should be a regulation that this is available, because there's a lot of people won't go to those events because they don't want the alcohol, and that's all that's served. So we think people should have a right to choose non-alcoholic functional drinks.
Sometimes you're walking down and you think, I could just go into that pub for a fish and chips or something. But I don't want to drink with alcohol in it just now. I don't want to drink with sugar in it just now. And I don't want to drink with artificial sweeteners in it just now.
Yes.
Whereas, what's this beer called?
GABA.
GABA.
I'm going to send you a bottle. Don't worry.
I'm salivating already. It sounds great. Well, can you see? You have to send a couple because my son will want one as well.
I will definitely. I'll send you.
It's interesting.
3 stouts.
My wife's had a few, but the last we haven't drank much. But after a couple, last night she said, "Oh, just have another one of those."
Well, you can tell her what I do, which is in the week, I just drink SENTIA.
Right.
And at the weekend, I might have open a bottle of wine and have a glass on a Saturday and a glass on a Sunday.
Yeah.
But But in the week, I find Sentia is perfectly adequate, relaxes you, improves your sleep, no hangover, and also it's got fewer calories than alcohol too.
Yeah. Interesting. Right. So the way forward, there are way forwards. People will always want some kind of escape. I think to deny that is
Precisely, John. Precisely. The idea that why would you want to live your life without relaxing if there was a safe alternative? It makes no sense at all.
Absolutely. Can you buy it in local shops? I've never seen it. You can't. Your mates kindly sent me these samples. So
yeah, it's technically it's actually quite difficult to sell things in shops because you need. So we sell it. We tried that. We actually tried to and sell it in bars and things, but you need a huge sales force. We're a tiny little company. We've just so now it's just basically it's all online because that's the only way we can afford to survive. At some point we would like to get it into shops when it's become more popular, but at present, it's really word of mouth. And actually, that's one of the nice things about talking to you because I know you've got a lot of listeners.
I have some amazing people on the channel. That's I don't think people listen to me, but for some strange reason, world-leading professors come on the channel, and in all due modesty, you're one of them. So, Professor, thank you so much for coming on.
Sean, great as always to talk to you, and
always.
Let me know how you get on with the GABA, all right?
I will. I look forward to it, and I might have one of these tonight as well. Thank you.
Fantastic.
Thank you.